Welcome to Fertilish, the podcast where we get real about fertility, infertility, and everything in between. I'm Laura.
And I'm Brandis. And whether you're knee-deep in treatments, just starting to ask questions, or somewhere in the ish of it all, you're in the right place.
Here we ditch the stigma, break down the science, and have candid conversations about the messy, emotional, and sometimes hilarious journey to growing a family and preserving your fertility.
So grab your coffee, your meds, or just your curiosity, and let's get into it. All right. Well, we are back for another episode of Fertilish, and today we are talking about IVF add-ons and immunology.
Yes, we get so many patients that come to us and inquire about our reproductive immunology program and add-ons and what to add on and when it's applicable and when it's recommended and all the questions. And so I think that this will be super informative and highly favorable topic to go over. I think CNY offers so many things that, you know, not every fertility clinic offers, and we offer so many different options because we do, really want patients to have, not that other fertility clinics don't want patients to have success, but we just offer a variety of different options that can help a variety of different patients in a variety of different circumstances.
Yeah, well, and, you brought it up that, CNY is one of the fertility clinics that does offer immunology treatments, not only as a reproductive immunologist or an RI, hard to get into, and, that's expensive as well. But I think it's pretty cool that Dr. Kiltz kind of is an earlier adopter of different methods of treating people, and that we can offer these things because, a lot of clinics really don't. Or it's very limited.
Right.
And, I always do explain to people, these add-ons can be controversial because there's not a ton of studies on them, and some of them are fairly new treatments. And so I like to use them in patients with, unexplained infertility. Usually I'll tell people, just because you have a diagnosis of unexplained, it doesn't mean nothing's wrong. It means nothing that we have a test for right now is wrong.
That's right.
And so, is the immune system playing a role? And that's where, this could come in. Recurrent pregnancy loss, recurrent implantation failure with euploid embryos. And see, these are all, scenarios where I think these can play a good and important role.
Absolutely. And, I think that even if there's not a ton of studies showing with absolute certainty this, can help this, there is data behind the theory of why it can help a certain thing, and it's not going to hurt anything to do these.
Yeah. If it's not going to hurt anything, why not try it?
Right.
So I think, that's a good point. And you have even had experience with a lot of these or some of these therapies too, right?
Probably all but one.
And we'll go over kind of a lot of things today. We have different platelet-rich plasma or PRP therapies, different types of that we do. Infusions like intralipids and immunoglobin. I'm saying that right. IVIg. Endometrial washes and scratches. And we'll go through all of those today as well as our immune protocols.
Just kidding about all but one, but I have quite a few.
So when we get to those, you can kind of say your experience with them and how that went.
For sure.
Okay, so maybe we'll start with PRP therapies. There are 3 different kinds. So PRP, first of all, is where we draw blood from you, the patient. We spin it down and we separate out the PRP from the other components of the blood. And PRP is filled with a bunch of growth factors and cytokines that we can use in a couple of ways. So the first one is intra-ovarian PRP, where it's kind of done like an egg retrieval. So you're asleep for it. There's anesthesia. And we put once we have the PRP separated out, we put it in a syringe with a long needle. It's kind of like an egg retrieval needle. And we put half of it in one ovary and half in the other. And it, this can help people with, a diminished ovarian reserve, or those that have had poor responses to IVF in the past. Sometimes it can temporarily increase AMH. Important to know that we can't make more eggs, but sometimes we can recruit more for the next cycle. So it can help with kind of follicle recruitment. And it's shown to also help with folliculogenesis, which is getting eggs to kind of a mature stage. So that's intra-ovarian PRP. Have you done that one at all?
I have not, but I think you mentioned that it's kind of similar to an egg retrieval, and I wanted to note that you can have it done during an egg retrieval.
Yeah.
It just wouldn't help that current cycle. Mm-hmm. It wouldn't, obviously have any effect on that egg retrieval. It would be for a subsequent egg retrieval. And so we do have patients that kind of add that on sometimes. Mm-hmm. They've already planned to do an egg retrieval, and they want to add on intra-ovarian PRP during that egg retrieval, knowing that they're going to do an additional egg retrieval that they're hoping to have success with. That way they don't have to have, it kind of cuts down by one procedure.
Yeah. Well, and you bring up a good point, is a lot of people, I feel like, ask, well, when should I have that done if I'm going to do one cycle? And you're going to get different answers because, again,
Sure. These
are new treatments. So sometimes it's a cycle before. Sometimes you'll have providers that say, well, up to 3 cycles before, because it takes eggs that long to, for lack of a better term, line up to ovulate and go out into the ovaries. Like Laura said, you can do it after your egg retrieval. So we'll retrieve all the eggs, and then we inject the PRP, so that way it's kind of there and hopefully can increase follicle yield for the next cycle.
And you're not having to go under anesthesia for a separate procedure.
Yeah. Which, interesting thought, there are some people that think that the reason it can increase follicle yield is because we're putting a needle in the ovary and removing it, and that ovary has to restructure itself. And those healing properties are what's causing the increased follicle yield, not necessarily the PRP. But then there are, so again, the new treatment, lack of studies on some of this, but that's one mechanism that they're thought that works. So that's why, even in back-to-back cycles, if you're doing an egg retrieval, that kind of restructuring can also help with recruitment. So just interesting thought.
My experience with PRP, I didn't have it completed, but before I worked for CNY, I worked in healthcare administration for many years, with the majority of that time being in dentistry. And I had a dentist that I worked very closely with for a few years, and he was like the perpetual student, so he was like constantly just soaking up knowledge. And so he got really big into PRP, and we did a lot of bone grafting, implants, things like that. And so we got the machine. He was like, hey, I really want you to buy this for me. And I was like, all right, I trust you. Let's get it. So we got the machine, and he started doing this for his implant patients. So patients that were they were having all their teeth extracted, and they were getting what's called like an all-in-four, so it's like a permanent denture, and so it's held in place by multiple implants. So the only people that can remove it is you have to in the dental office. And so, it's the implants are implanted into the bone, obviously. And so he was doing this for those patients, and he saw drastic healing, much shortened healing times. And then my daughter, she had it done. She had PRP done when she got her wisdom teeth out. And literally no pain. None. She took some ibuprofen that first day, like after she had, come out of anesthesia and she was a little sore. Literally the next day, I was like, you don't even want to take any ibuprofen? And she was like, no, I'm fine.
Interesting. So
she didn't have bruising.
Did they just inject it into the socket?
Yeah.
That's so interesting.
And then stitched everything back up. Mm-hmm.
Huh. See, and I had when my wisdom teeth were removed, I didn't do the PRP, but I don't remember, I was like a sophomore in high school, and it wasn't painful. I did do the ibuprofen thing, but oh my gosh, yeah, the next day, I remember somebody telling me, oh, do you still have the gauze in your cheeks? And I was like, no. Like,
so it reduced.
Okay.
Yeah. So we saw like a reduction in swelling, a reduction in healing times, a reduction in bruising, a reduction in pain, and a reduction of dry sockets.
Okay, that's what I was going to ask, actually. Okay, that's interesting. Well, and we know that cytokines are little like messengers that help to regulate the immune system. And so there's such a lack of, like I said, of studies on how, it can affect fertility and different things. But I think it's such an emerging field. And right now, I always say this, we may say, there's not a ton of studies. And then in a year from now, it'll be like the holy grail because now we have all of these things. So,
what's even used in aesthetics now? Like,
yeah.
So, I mean, and so if you think about it, like, it's helping to rejuvenate, making more youthful your skin. So if you use that same, like, application to your ovaries, it makes sense, why it would be a potential therapy specifically for people who have diminished ovarian reserve.
Yeah. Well, and so that's just one way we use PRP. There are two other ways. One is a way to get to the ovaries, I guess. It's called high volume PRP. So you're awake for it. Obviously, intra-ovarian, you're asleep, but you're awake for the high volume. We put a speculum in the vagina. We cleanse the cervix. A small catheter goes through the cervix into the uterus. And kind of a larger amount of PRP is pushed into the uterus. You have to have open tubes, obviously, for this to work because it goes out the tubes, and the thought is that it will bathe the ovaries. That is called high volume. And then we have just a regular volume, just PRP uterine wash, where same process except it's a smaller amount of fluid. We just inject it into the uterus. And usually this is done 1 to 2 days or 24 to 48 hours before an embryo transfer to kind of help with receptivity in a way. And then if we're having trouble growing a thick lining, occasionally we will use it in the follicular part of the cycle, so the beginning part, to kind of help that lining get thicker. So those are the 3 ways we use PRP anyway. Any of those have you tried or no?
No,
No
I've
PRP.
never done any PRP with CNY, but I know we've had several patients. I actually had a patient that reached out to me recently who she was like really struggling with, like you said, getting her lining to be thick enough. And so she had several not several, I think a couple of failed cycles in a row where we had, added medications and done several other things. And so that was kind of be the next step.
Yeah.
Is she was like, all right, I'm, really trying to find someone local to me. She doesn't live near any of our clinics that can do PRP for me for receptivity before her transfer. And then finally she messaged me the other day and she was like, all right, I'm just going to Atlanta.
Well, so you bring this up too. Patients we do have patients that just come to us for PRP or for an add-on. We have patients that are doing IVF at other fertility clinics, and they'll set up a consult purely for intra-ovarian PRP or or a PRP wash, and that's all they do here because we offer it, and that's fine to do too.
Yeah, absolutely. We sure do. I get asked about that quite often. Like, is it okay if I'm doing, fertility with like a local clinic to me, but I really would like to come to you guys for PRP? And I'm like, yeah, that's absolutely
Yeah.
fine. Like, we'll help you. Absolutely.
The other thing we offer are infusions. So the intravenous immunoglobulin, IVIg, and lipids. IVIg is an infusion, so an IV. The thought, and again, this is a newer treatment, the thought is that it decreases natural killer cells. And so natural killer cells are a type of white blood cell that is an attacker cell, basically. So it fights things off like infection and cancers. And we do think that there may be an immune component to those people that are having, unexplained infertility, recurrent pregnancy loss, recurrent implantation failure, to where the body is seeing this embryo as a foreign body and saying, okay, don't implant.
Right.
And so the thought with IVIg is we kind of decrease that natural killer cell response.
And what is the frequency that's recommended if you do that treatment?
Honestly, it's pretty expensive. I know some people that will do it around transfer time.
Okay.
And then they'll continue it weekly through the first trimester.
Okay.
Sometimes cost is a huge barrier, especially for IVIg.
And a lot of insurances are not paying for it.
Yeah. And I think it's like a it's a multiple hour infusion, so time constraints are also a big thing. I think it's only a part of our immune level 4 protocol, and so this isn't a common thing that people will see, but that's kind of what it is doing. It's supposed to be kind of suppressing that immune response.
So still similar intervals to like intralipids, I'm assuming.
Yeah, so intralipids are another IV that we have in an add-on, and I think those are in immune level 2 and up. Same kind of thought with those, is that they suppress natural killer cells. They do have egg in them, so if you're allergic to eggs, we have other options like Omegaven, which is a different form of lipids made from fish oil. And so if you have a reaction or you're allergic to egg yolks, we can switch you to this one. But yeah, it's done either the day before or the day of transfer, and then continued weekly, usually through the first trimester, if that's something you're doing. And I know you tried lipids, right? You've done lipids before.
I have. And it's painless. I think that the most painful part of lipids is trying to find a place to get it done if you don't live near one of our clinics. We are really working on that, trying to find additional, just like we have monitoring partners all over the U.S. We're really trying to increase the clinics that work with us to provide lipids for our infusions for our patients, so that way that doesn't become a barrier to being able to receive that service, because it is something that you need to have done more than once, not just like on the day of transfer. So we really are trying to work on that. We always love to hear from patients when you have been able to find someone in your area that has been able to, either monitor for you or has, performed infusions. Please let us know, because we love to reach out to them and say like, hey, I know you've helped some of our patients. Is this something that you would like to be able to help more patients?
Yeah.
So that we can put on our monitoring map. So that other patients can find them as well. So please, you can even just DM us on our Instagram, because that's part of my that's part of what I do at CNY.
Yeah.
And so, you can just DM us directly, fill out our Fertilish form, cnyfertility.com/Fertilish. But yeah, if you've had a place that was able to perform infusions for you, please let us know. And we're we're working on some other things. So hopefully we'll have something to report later. But yeah, that's something that is, we do find that can be a barrier sometimes.
Yeah, and you brought up, so yeah, it is hard to find somewhere that can do IVs for you. There are some, I know there's like some home health agencies that'll send nurses out to do infusions. I know some people have gone to their OBGYN and had them do it. Some offices don't feel comfortable doing that with meds that they didn't prescribe.
Right.
So, that's a thing. But Laura brought up our monitoring map, and we've talked about it before in the Traveling for Treatment episode, I think. But we do actually have a map on our website. I think it's under travel.
Mm-hmm.
It's like, if you go to our main page, it's like on the top row of like things to choose from. And then Traveling for Treatment, and then you scroll all the way down to the bottom, and there is a map of places that offer monitoring, like ultrasounds and blood work and stuff like that.
Yeah, and we do have some infusion partners on there.
Okay.
Obviously, we're just trying to grow that network for sure. I have also found that sometimes, like the mobile IV therapy, like where people are getting, like they're dehydrated and so, like hydration therapy, that sometimes they're able to do it for patients as well.
Okay.
Because that's essentially what they do, is they just travel around hooking up IVs.
Yeah.
Some of them are more comfortable with it and than others. But that's also, it's always worth a try to just like check in your local area. And some of the partners that we have now are literally because I was like scrolling on Instagram and just saw them and called them. It's like, hey, will you offer this to our patients?
Yeah.
Or we've had patients that have been like, hey, I had really great success with this. I was able to get infusions here. So it's just random how it comes about, but we definitely are working diligently to try to find more places to be able to, truly like partner with us. But if we don't have someone on the map in your area, I always recommend, like you said, like, checking with your own OBGYN, checking with like infusion facilities in your area, the mobile like hydration facilities, because they're, nurses that are coming to you that are, hooking up to an IV. Since this may be some, or even your PCP.
Yeah, some PCPs, especially if they know that you're going through this treatment, yeah, they'll be open to doing it for you. The other thing we offer, so we have infusions, we talked about PRP therapies, we do have uterine washes or endometrial washes. Again, we talked about the PRP one, so you're awake for it. It's just done with a speculum and a catheter. There is a Neupogen wash. So Neupogen is just a man-made substance of basically of something that your body already makes. It increases your production of neutrophils, which is a type of white blood cell. And the thought behind it is that it helps regulate the immune system. It can also, again, newer thing, but it is thought to help improve the communication of the reproductive system. And so usually I like to use it for lining thickness, kind of like PRP. I like Neupogen a little bit better for to help thicken a lining, but I do like PRP as well. Again, you can do it 24 to 48 hours before an embryo transfer, but usually I'm using it in those patients where we can't get the lining thick enough, and I'm using it in that follicular phase. Sometimes it's just one that we can do, and then sometimes it's kind of a series of multiple washes in a row to kind of help that lining. And then the other one is the HCG wash, where we're putting a little bit of pregnancy hormone 24 to 48 hours before an embryo transfer into the uterus, and it's supposed to help receptivity, and that's something that everyone can do to help receptivity of an embryo to kind of be in the uterus, and that's what that thought is behind that. There were same-day HCG washes for a while that people were doing. Really, we don't want anything in the uterus besides us and the embryo that day, so We don't really do those anymore. It's just the 24 to 48 hours before that's recommended.
You don't want too much fluid in the uterus, right? Is that
Yeah,
what
they were doing, so it's a microdose HCG wash that some studies were showing, but we saw a decrease in pregnancy rates with those. We're putting fluid in there. We're putting a catheter in there. So really anything that's kind of disturbing that uterus and that lining on the day of,
Sure.
we don't want. And so that's kind of the thought behind that.
So I have had an HCG wash with a transfer, and then I didn't do a Neupogen wash, but I did Neupogen injections.
Okay.
So I think I had the HCG wash 2 days before. Yeah, I think it was 48 hours ahead of time. And then the Neupogen injections, just started those, I think when I started progesterone, I believe, and then continued with those just daily or whatever. 20 units of
Neupogen.
Mm-hmm.
And important to know, because it does increase your white blood cells if you have your blood drawn.
Yes.
And you go to the doctor and they say, oh my gosh, your white blood cells are high, you have an infection somewhere. That's from the Neupogen, so don't freak out. And we do monitor you weekly with white blood cell, or we draw your blood and look at white blood cells weekly with that, so we can kind of manage that med.
Yes, making sure that it's not getting too high, or just making sure we know what's going on with your white blood cells. So when you do if you're monitoring at a local lab and you get your results in a patient portal, you are going to get an abnormal value.
Yes, it's going to be red.
Right.
So yeah, we do monitor that. And then another kind of endometrial treatment we have is something called, and we don't really use this a ton, again, it's not a first-line treatment. Sometimes we use it for recurrent implantation failure, but it's called a endometrial scratch. Basically, it's a biopsy, and you are awake for it. Again, we put a speculum in. A biopsy catheter goes through the cervix into the uterus, and we're taking a biopsy. We're intentionally damaging the lining of the uterus, and this is done in the luteal phase before an IVF cycle with a fresh transfer, or in the luteal phase of the cycle before a frozen embryo transfer. Because the thought is that when that uterine lining heals itself, it starts to release chemicals that make, and kind of healing properties that make the uterine lining more receptive to an embryo. And that's the thought behind that. Now, usually I tell patients, hey, we're already going through the hassle of, getting a biopsy. It's kind of crampy. Since we have tissue, we might as well send it off to LabCorp for testing, to test for things like CD138, which is associated with, or plasma cells associated with endometritis or chronic inflammation of the uterus. So if we're going to do a scratch, might as well send it off to pathology.
Sure, absolutely. Why discard it when we could get some information?
Yeah. So I always like to send it off. Some patients, I don't know what the LabCorp fee is. I want to say around $200.
Okay.
But sometimes that's a barrier for people. Sure. So if cost is a thing, but if you're going to go through it, it's worth it to just send it off.
Yeah, absolutely.
And all of these things, or some of these things, are part of our immune protocols. So like lipids, IVIg, Laura talked about injections of Neupogen. So we do have immune protocols 1 through 4. If we know the reason for infertility, same-sex couple, you have tubal factor, there's male factor, I'm less apt, really, to add on these immune protocols. But, if it's unexplained, if you do have recurrent pregnancy loss, or you have autoimmune issues, Hashimoto's, rheumatoid arthritis, usually we do kind of increase the immune protocol, and sometimes we even work with your whoever manages kind of your autoimmune conditions to kind of manage these with us.
Yeah, absolutely. I think that like it's important to note that it can be a comprehensive effort between all of your providers to help you reach this goal because your whole body comes into play.
Oh, yeah. And I think it's important to ask your provider when you have your consult or even a follow-up talk, hey, what immune protocol am I on, or am I on one, and what's the reasoning? Like, what level do you think I should be on, and why? And all of us are kind of happy to review that with you as well, so that way you kind of know what meds you're on and what they're for, and why we think that.
Yeah, and you can actually find those on our website as well. We have, it's like under fertility enhancements, I think is the name of the page. And so there's a list of all 4 immune protocols. It even goes in depth about like different medications used. It gives more information. And then there's a list of all 4 immune protocols and all of the medications used. And there's information on like when they're started in the cycle and kind of how to utilize that whole approach. So there's a lot of really great information on the immunology add-ons or immunology protocols.
Yeah, and if you can't find it too, you could Google, I think it's like CNY fertility immune protocol, and all of the protocols will come up, and it's cool because it gives you all of the meds and what the mechanism of actions are, and we'll kind of review those.
Yeah. There's a lot of helpful information on the website.
So with immune protocols, there is aspirin on there. It's just a blood thinner. So the thought with aspirin is to increase the blood flow to the uterus and help with ovarian responsiveness. If you have a recurrent pregnancy loss or a blood clotting disorder like factor V Leiden, we are typically recommending things like Lovenox before an embryo transfer. So those are kind of the blood thinners.
And I have taken both of those, and just forewarning, Lovenox will leave a multicolored tummy for you because it does thin your blood, so it's making you bruise. So it's not painful, or I never found it to be painful. It's just, just have some color to your stomach.
Yeah, so aspirin, obviously pilled by mouth. Lovenox is an injection.
Yes. Sorry, I could have mentioned that.
It's done in the belly, and it's super tiny needle. Same. I've heard some people say it burns. Maybe.
I think I mean, it's not bad. It's just a little sting.
Okay.
I didn't find it to be terrible or anything. But yeah, I think that for people who are first taking it, I think they will be, a little surprised by the bruising initially. Yeah. It's not painful bruising, but it does kind of catch you off guard when you first see it for sure.
And sometimes it can look shocking. We do have patients that call in freaked out, like, oh my gosh, my stomach looks like this. Is this normal? Am I like bleeding? That it's 100% normal. Yeah. If you're ever super concerned, you can always come in or email us a picture or kind of whatever you feel comfortable with. And we can kind of reassure you, but yes, it does leave some pretty gnarly.
Yeah, because it can be a little alarming when you first see it if that's your first time taking it, and so I think that it catches people off guard a little bit at first because now I will say that like I always tend to feel like that it gets better like the more injections that you get. So those first few I feel like they do bruise a little bit worse, and then they kind of fade and it's not bruising as bad. So initially, especially if it's your first time taking it, you're going to be like, what in the world is this?
Yeah. And, some of these things, like people with blood clotting disorders, so you graduate from CNY at 8 weeks. And so sometimes some of these meds will have you continue through the first trimester, and some of them will kind of leave up to your OBGYN. Some OBGYNs, depending on your scenario, will have you continue even the Lovenox up until a week before birth.
Yeah.
And so as far as that goes, a lot of these things we do hand off once you graduate and kind of let them make that decision on when to stop.
Yeah, and I think that it's important to know that like all of these medications are not necessarily out of pocket. Like for I've found that a lot of patients like the Levinox, their insurance will pay for even if they don't have any fertility coverage.
Yeah.
So I always recommend, these are not drugs that you like necessarily have to get from the fertility pharmacy, that you can get them called in at your local pharmacy, process. Well, I mean, you can get them filled at the fertility pharmacy too, but sometimes it's just nice to have be able to go and pick it up when you're like, oh crap, I'm low,
Yeah.
But you can just like, see what, process your insurance, see if your insurance will pay for it, even if you don't have fertility benefits.
Yeah.
And then, if your insurance won't pay for it, I always recommend trying the GoodRx coupon. And most pharmacies have that on hand, and they can just enter it. You don't have to have a subscription. They can just enter a number for you, and they can tell you what the price would be.
Yeah, GoodRx is amazing. If you don't know what that is, it's a website and an app. You can put in, and you can use it if you have insurance too. You put in any med, and it'll give different prices for different places. And you bring in the coupon and they scan it or type in the code and you get it for that price and don't have to use your insurance. But a lot of the times things are a lot cheaper.
Oh, absolutely. Like drastically. And there's a free version and there's a paid version. I guess that's like even more cost savings. I think it's like a platinum or something. GoodRx platinum.
Oh, interesting. Okay. So you could pay for like more.
It's minimal. I think it's like $10 or maybe 15 or something like that. But it has extra perks. So you can just look at it, there's like a graph side by side that shows you what each one of them has. But even if you don't have a prescription, most pharmacies have like a number on hand that they can just input it and say like, oh, it would be this with GoodRx.
And sometimes it's cheaper than even using your insurance.
Yes.
So it's always worth checking.
Yeah, for sure.
Anything to save money at any point in this process.
That's right.
You should do it.
That's right.
And we do have our antihistamine protocol, which is Claritin, Pepcid, and Benadryl. Same kind of thought with all those is we're kind of decreasing any form of inflammation that may be in the body.
Do you recommend taking those at nighttime? Just in case Benadryl makes you sleepy.
Benadryl, yeah. Even if I take it at night, I feel like the next day I'm groggy. It doesn't affect everyone that way, but yeah, at night for sure. Good point. Antibiotics are a part of our immune protocol. So usually it's doxycycline. If you're allergic to it, we have alternatives, but it's to treat any sort of chronic infection or inflammation that may be in the uterus. Again, things like endometritis can be one of those things. Tacrolimus or Prograf is another med that's part of our protocol, and this is actually kind of a cool one. They were looking at people with kidney transplants that had embryo transfers, and they found that their rates of pregnancy were higher, and then they found out that it's because they're on an organ-rejecting med called Prograf. And so, kind of the thought was that, okay, maybe the immune system is playing a role in kind of rejecting this embryo and seeing it as a foreign body. And so the dosage for that is 3 milligrams a day. So it's either 1 milligram 3 times a day or 1.5 milligrams twice a day. It is shown to help patients with recurrent implantation failure and recurrent pregnancy loss. So that's another med that's on there.
I do recommend setting an alarm. I just had this conversation with you not too long ago. Because 3 times a day to take a medication is a lot. It's a lot to remember. And so there's a couple of like little apps that you can use for free that will help you. And some of them are like fertility related. Set an alarm or something, because inevitably you're going to be like, oh crap, it's 12 o'clock and I didn't take that medication and now I'm due for another dose. Or so when you're busy, you're working, it's hard to remember to take a med 3 times a day. So setting a little alarm, that's my little tip for for that medication.
Yeah, and I know that we've talked about this too. They have all kinds of like cute pill organizers. They even have them on like TikTok Shop, but sometimes there's just not enough compartments for everything IVF. So
Right.
yeah, an alarm is helpful.
Yes.
Prednisone, another one for kind of autoimmune. It's a steroid. I'm not a fan of it long term because sometimes it could do more harm than good, but used in the right context for the right amount of time in the right situation, it can be helpful.
And that's something that you won't want to stop cold turkey.
Oh, yeah, good point.
Is if, let's say, you need to stop the prednisone, then you'll always want to taper down instead of just stop taking it altogether.
Yeah, and I don't like people on it for, like, if you have a negative beta, negative pregnancy test, and sometimes they'll say, okay, stop everything, but you're prenatal, or, you could stay on the prednisone in the prenatal. I like to wean people off. Yeah.
Yeah.
If you're not doing a transfer, I'm going to wean you off.
Yeah.
I don't want you on it all the time. And so those weaning instructions vary on kind of the dose you're taking. So if you want to come off of it, please make sure to either write in or call in and ask, for weaning instructions, to come off.
Yes, and I don't like it for a different reason. So I'm going to always want to wean off of it myself, but because it makes me want to eat everything.
Yeah.
And so
and it can keep you awake too,
Yeah.
so that's one to take in the morning.
Yes. I will try to eat all the things I don't need to eat. So, because it makes me just, I feel like I'm just famished constantly all the time. So, just be aware of that and like healthy snacking.
Yeah, which is hard to do when you're starving
Absolutely.
with that.
And you just want carbs.
The worst. Low-dose naltrexone, or LDN. This one is an interesting one. It's not really fully understood how this one works. It's an immunomodulator, so it improves endorphin stimulation and kind of modulates or regulates the immune system. We added on because really, studies really don't show any harm. So it's another one of those things where if it can help, why not? It's also used in people with autoimmune diseases like MS. So it's kind of cool that it's being adopted in the fertility world. Some people do have nightmares with it, I've heard. So if you do, do I think it'll make or break your cycle if you have to stop it? No, but I think it's an interesting one. Have you tried LDN at all?
I did. It didn't agree with me.
Okay.
And so, and that's exactly what I was told. Like, hey, it's not going to make or break your cycle. So if it's like causing you disruptions with your sleep, because that's exactly what was happening. And it was like, kind of upsetting my tummy. So they were just like, just don't do that one.
Yeah.
But I've known a lot of people that have taken it and haven't had any issues with it whatsoever. So, important to note that if you are having issues with it, it's better to just like not be on it than be on it and, not be getting any sleep or, constantly getting up in the middle of the night. But if it doesn't bother you, then it's not gonna, it can only do good, no harm. Yeah.
If it's causing you GI issues or nightmares, you're not sleeping, obviously, then at that point, it's just better to come off.
Right.
Human growth hormone, Omnitrope, is the most frequent one used, is an injection. It does increase, or it works by increasing something called insulin growth factor 1, or IGF-1, which helps eggs to have more receptors on them to respond to the medications we give you. So I like to use it in those, I'm a fan of Omnitrope, that are poor responders, or those with kind of a lower egg quality. I'm a fan of human growth hormone. Occasionally, they'll use it in transfer cycles to help with lining thickness, but usually this is more of kind of an egg retrieval thing.
That's what I took it for, was
egg retrieval.
Egg retrieval.
And I used it for, I've used it in my own egg freezing cycle. And it's the one I had was refrigerated.
Yes.
So make sure it's in the fridge. Again, needles small. These are pretty easy injections, and it was one that like didn't burn at all. So that's an easy one.
Yeah, and it's like super low dose. So I mean, you feel like, did I even inject anything? Because it's a tiny amount.
Yeah, and then as far as, how many units you're using and when, that's going to be up to your specific protocol. So just make sure to ask your provider.
Sure, absolutely.
Neupogen, we talked about that one. Increases neutrophils and helps regulate the immune system. And I think we've kind of went over all of the immune protocols and different add-ons. Do you have any kind of other?
I think that it's important to note, like, if there's something that you want to try, just always mention that to your team. Because even if it's not something that's maybe like been prescribed for you, but you're interested in it, you know someone that had success with it and you would like to, know more about it, whatever it is, it's the science behind it intrigues you. Just always mention it to your team, whether that's the global travel team or your provider during consult, whatever that may be. And they can kind of talk to you about whether they would recommend that for you and like what that looks like for you. Like, for example, Neupogen, with that being, you could do that as an injection or you can do that as in a wash. And so if that's something you're inquiring about, they may have a recommendation on which one they feel like would be more applicable to you.
Yeah.
And so there's a lot of nuances with it. And so, yeah, I think that it's important to just like say, hey, I'm interested in this.
Yeah.
I want to learn more. Like, would you recommend this for me?
Yeah, and another important kind of key note to this is that I know there's support groups out there, and I know, some people will say, oh my gosh, this person has, I don't know, IVIg in their protocol, and I didn't get that. This is why it's so important. That person may have a totally different history than you. That person may be on their 10th miscarriage, and we know that your tubes are blocked. So everyone's treatment is always going to be individualized. I think support groups are good for just that support. But as far as medical advice and protocols, make sure you're always reaching out to us for that. As far as, people with autoimmune disorders, like we mentioned, we always like to work with other providers in developing these if you're already on some of these meds. And of course, there are special considerations for people who have had cancer in the past. We're not going to put you on human growth hormone or some, different things. And so this is also kind of a really individualized thing.
Absolutely. And I also don't want patients to stress out because, if you decide to add on all the things, it is very costly and your insurance may not pay for all the things. And I don't want that to be a barrier between you getting treatment or not. So if you can't afford to do every add-on that we have available to you, that's okay.
Yeah, and like we kind of mentioned, a lot of these things are new. They're still in the experimental stages because they haven't really showed harm. But, a lot of these things, do I think they're going to make or break your cycle? No. I do know people that have gotten HCG washes and that was their transfer that took. And so now they swear by it and they have to do it every time. Majority of the time I always tell people, honestly, it was probably just getting to the right embryo. But, these things can technically only help, but will it make or break a cycle? Not necessarily, no.
I see that, and when you mention support groups, I see that quite often. Like, people will ask, like, well, what was the thing that you did differently this cycle? And so then they'll say, oh, well, I did XYZ, like this add-on or that add-on, or I didn't do that. And that doesn't mean that that's gonna be the thing that works for you, because none of this is like the just magic key for every single person. Otherwise, it would be mandatory for every patient.
Yeah, well, and it's like, no, what actually happened is Susie had 3 transfers of 3 abnormal embryos, and her 4th one was a euploid.
Yeah.
But she just happened to do this on this transfer. But yeah, you're right.
Yeah, and maybe it did help receptivity, and that's wonderful. But yeah, if I promise you, if there was like the magic pill or injection that we like could give every single patient, and we knew that was going to make that transfer Well, we would.
Oh, yeah, no. And if I was going through this, I'd be like writing to the Etsy witch to like give me some like spell or something to help. So I get wanting to try everything.
Oh, absolutely.
But like,
Yeah.
don't stress out over it.
Yeah. Oh, yeah. No, that's because I myself am guilty of like, well, I need all the things. So
Yeah. No, and I get it because I'm the same way. And I think that's like human. So hopefully, this was helpful in learning about these different therapies and what we use them for.
Yeah.
And the situations where they would be helpful, and kind of understanding how they work so that you can maybe advocate for yourself.
Yeah. And I think that understanding the science behind it is the key part because if you understand the science, obviously you know your body very well. You understand what your individual journey has looked like, what's led you to this point, what your health looks like with your PCP or your endocrinologist or your nephrologist, whatever it is that you have going on outside of us. And so it helps you to be able to ask the questions or say, hey, is this applicable for me if you do understand the science behind it.
Yeah. Well, again, make sure to bring it up with your provider.
Yeah.
Ask them which immune protocol they think you should or shouldn't be on and why. If you have any questions about any add-ons maybe we didn't get to, I think we had a lot of them. Send us a message on our Instagram, comment, and make sure to if you have experience with any of these therapies, or like Laura mentioned with the IV clinics, if you found a place that does IVs for you, let us know.
Yeah. Absolutely.
All
We'll
right.
see you back next week.
See you next week.